Great, thank you very much. And you're right. I think that's the first time I've been introduced by a managed care, former managed care nurse. Thanks so much, Ray. And thanks for inviting me to be back in Virginia. Back in the state I used to live in. I did used to live in Northern Virginia, and I grew up in Northeast Tennessee, very close, about a mile from the Virginia state line. I lived in Arlington for a few years when I worked in Washington, D.C. How many of you all have any young children? How many of you all have either young grandchildren or great-grandchildren? How many of you have young nieces and nephews or cousins? How many of you like children? Tolerate children? That's very good. Folks, you might find it hard to believe, but the children you know might have a better chance of achieving the American dream if they move to another country. America is no longer the land of opportunity that it used to be. Children born into poverty in Canada, Britain, Germany, and France have a statistically better chance of reaching the top rungs of the economic ladder than poor kids in the U.S. Among children born into low-income households in this country, more than 2 out of 3 grow up to earn a below-average income. Only 6% make it into the top 1/5 of income earners. The U.S. is also losing its entrepreneurial edge. According to the Small Business Administration, Canada and Denmark have overtaken the U.S. as the best countries for entrepreneurs. Americans are finally waking up to this new reality. According to surveys conducted this spring and summer, 51% of American adults believe the quality of life for children today is worse than it was a generation ago. Even worse, 60% of us say that today's children will be worse off than their parents. What happened? Why are we now eating other countries' dust? And what can we do to turn things around? Well, there are a lot of reasons why we're falling behind, but at the top of the list is the fact that we have a healthcare system that has been shaped over the years by special interest, more concerned about preserving profits than in meeting the needs of average Americans. When you get right down to it, it's a stretch to even call what we have in this country a healthcare system. Unlike other developed countries that took deliberate actions years ago to create national programs to ensure that every one of their citizens has access to affordable quality care, we in the U.S. allowed big corporations and powerful lobbyists to shape what passes for a system. A doctor friend of mine won't even use the word system. He calls what we have a sickness industry. To understand why we have a sickness industry instead of a true system, why, despite the fact that almost 51 million of us are uninsured, healthcare spending has become the single largest category of the federal budget. Why, in other words, healthcare reform was so urgently needed and absolutely must go forward. To understand that, I need for you to do a little time traveling with me. Our first stop is going to be 1929. That's the year that a hospital administrator named Justin Ford Kimball came up with a scheme to keep his hospital from going broke. Kimball's idea was to guarantee teachers in Dallas, Texas, up to 21 days of inpatient care a year in Baylor University Hospital if they got sick, so long as they would pay 50 cents a month. It worked better than Kimball could have imagined. In fact, it was so successful that other nonprofit hospitals around the country started similar plans. Eventually, these tax-exempt efforts were united under the common name of Blue Cross and Blue Shield, which were actually it was Blue Cross. Blue Shield was created a few years later to provide physician care. These early health insurance plans were fair and equitable compared to most of today's insurance plans. That's because they used something called community rating, which means that they charged everybody the same amount regardless of age, gender, or how healthy they were. It met the needs of a fast-growing number of people for several years, and it probably still would if the big for-profit commercial life insurance companies hadn't messed things up. They wanted in on the action and figured out that they could make a lot of money by marketing policies with lower monthly premiums to young and healthy people. As these commercial insurers cherry-picked the young and healthy, the older and sicker people who remained in the blues plans saw their premiums go up. Since these commercial insurers were not tax-exempt nonprofits, they didn't have to use community ratings like the blues did. What they did was replace community rating with experience rating. What they did was replace community rating with experience rating, meaning that they based premiums that they charged employers who became their main customers on how much employers' workers were using their medical services. This soon became the norm, and it's why insurance companies today charge older people more than younger people, and sicker people more than healthier people. It's also why they charge women more than men, and why it costs so much more to buy insurance as an individual than as part of a large group. Now let's hop across the Atlantic Ocean for a couple of minutes. While the sickness industry was developing in the United States, countries in Europe, starting with Germany, began to establish national healthcare systems, true systems, financed primarily with tax revenues. Germany's system actually got its start in the late 1880s, thanks to Otto von Bismarck. The Iron Chancellor was certainly no socialist, but he was a smart politician. He felt that Germans would be more loyal to him and be healthier and more productive if they had access to decent medical care. Other countries in Europe eventually followed Germany's lead, although it took a few years to do it. France and England, for example, created their systems right after World War II. Now back on this side of the Atlantic, Teddy Roosevelt, who was envious of what Bismarck had done in Germany, became the first of many U.S. presidents to try, without success, to get a national healthcare system established here. Roosevelt, who was president from 1901 to 1909 and who was a Republican, often paraphrased Bismarck by saying that, quote, no country could be strong whose people were sick and poor. But Roosevelt couldn't pull it off during his first two terms and lost to conservative Democrat Woodrow Wilson when he ran as a candidate for the Bull Moose Party in 1912. So you see, we've been at this healthcare reform business in the U.S. for more than 100 years. But every time a president has attempted reform, various special interests have been able to block it out of fear that it might have a negative effect on their profits or their livelihoods. The closest we ever came until last year was right after the Second World War, when President Harry Truman took up the cause at the same time that French and British leaders did. But he proved to be no match for the American Medical Association. Doctors were afraid that Truman's plan would hurt their incomes. So they launched a fear-mongering campaign to persuade people that Truman's proposal, which they labeled socialized medicine, I bet you've heard that before, would play right into the hands of Russian communists hell-bent on taking over the world. The AMA was joined by the U.S. Chamber of Commerce and commercial health insurance companies in their opposition to Truman's proposal. Their success in killing it ensured that market forces and the income and profit expectations of special interest would continue to shape American healthcare. In the early 1950s, big employers became big players in medical coverage. Companies like General Motors and other companies began paying for medical insurance and pensions for their workers. That ignited a shift that continued for decades, and it eventually led to the takeover of healthcare in this country by large for-profit insurance corporations. More and more large employers realized that they, like GM, could self-insure by cutting their own deals with insurance companies. By doing this, they no longer had to belong to the Blue Cross type plans that still at that time used community rating. Throughout the 50s and early 60s, free market forces seemed to be working just fine. By 1963, 80% of Americans got their health insurance through their employers. Around that time, however, the nation's elderly were becoming a big problem for free market advocates. Employers who offered retiree health benefits suddenly had to jack up premiums, jack them up other current workers in order to cover rising costs of the older folks who had retired and who were needing expensive care. At the same time, elderly folks who were not so fortunate enough to have retiree benefits, as well as younger folks who were poor and uninsured, were creating growing demands on state and local governments and charity organizations. Until then, the American healthcare system had seemed to be a success. Now it was showing its Achilles heel. For the first time in the nation's history, a groundswell of authentic grassroots support for a government-run public plan was taking shape. As a result, President Lyndon Johnson in 1965 was able to overcome fierce opposition from the AMA and its business and political allies and get Congress to enact legislation that established the Medicare and Medicaid programs. Now, folks, as important as those programs have been to millions of people over the years, Medicare and Medicaid didn't come close to solving all of the country's healthcare problems, as we all know. By the 1970s, it had become clear that the U.S. was beginning to pay the price for not having a national healthcare system that covered all of its citizens like the European countries had. The free market system simply was not working to control healthcare costs and to bring everybody into coverage. A young senator from Massachusetts named Ted Kennedy took up the cause of a healthcare for all type of program and began advocating for a government-run single-payer system, which is what Canada has. But President Richard Nixon was having none of it. With the help from the AMA, he was able to scare members of Congress away from Kennedy's idea and to embrace a newfangled free market solution. So in 1973, Congress enacted the Health Maintenance Organization and Resource Development Act, better known as the HMO Act, ushering in the era of managed care. Well, we all know how that turned out. Although managed care plans succeeded briefly in reining in healthcare costs, Americans soon came to despise their HMOs that employers and insurers were forcing them into. Their doctors hated them too. Resistance was so intense that insurers eventually had to loosen many of the restrictions that had enabled them to hold down costs. It's around this time that I began my career in the HMO industry. After working for a couple of years for a nonprofit hospital system in Knoxville, Tennessee, I was recruited to Humana in 1989. Humana is a big for-profit managed care company. At that time, it owned a lot of hospitals. And I eventually became the company's top PR guy. From there, I was recruited to Cigna, an even bigger for-profit company. And I stayed there for almost 15 years and was serving as head of corporate communications when I left in 2008. For most of the time that I worked in the health insurance industry, I was a true believer in the notion that the free market system could work just as efficiently in healthcare as in any other sector of the economy. But the higher up the corporate ladder that I climbed, the more I could see why it absolutely does not. I became all too aware of the lengths that insurance companies will go to make sure that their boards of directors and their Wall Street masters stay happy. I also became aware of what the consequences of their practices are to the rest of us. I eventually became so disgusted with myself and what I did for a living that I not only walked away from a high-paying job, I began to speak out about how health insurance companies really operate. I felt compelled to disclose their dirty little secrets that enable them to make billions of dollars in profits every year while growing millions of us, of Americans, don't have access to affordable quality health care. The first time I spoke out was before Congress. Here's how I introduced myself to the Senate Commerce Committee on June 24th of 2009. My name is Wendell Potter. For 20 years I worked as a senior executive at health insurance companies, and I saw how they confuse their customers and dump the sick. Also they can satisfy their Wall Street investors. I went on to explain how the top priority of for-profit insurance companies is to drive up the value of their stock, and that to meet Wall Street's relentless profit expectations, insurance companies use a variety of means to drop sick people from their rolls. One is called policy rescission. Insurers look carefully to see if a very sick policyholder might have failed to mention being treated for something when applying for coverage. If they find evidence that a treatment or diagnosis was omitted, even a minor illness, insurance companies often use it as a justification to cancel their policies. Dumping even a small number of enrollees can have a big effect on the bottom line. a congressional investigation into just 3 insurance companies found that they had rescinded the coverage of roughly 20,000 people over 5 years, allowing those companies to avoid paying out $300 million in claims. So you know, when they canceled just 20,000 to save that much money, those people were very, very sick. Another way they avoid paying claims is by dumping small businesses whose employees' medical claims exceed what insurance company underwriters expected. All it takes is one illness or one accident among employees at a small business to prompt an insurance company to hike the next year's premium so high that the employer has to cut the benefits or stop offering coverage altogether, leaving workers and their families uninsured. This practice is known as purging, and it helps explain why the number of small businesses offering coverage to their employees has fallen from 61% to 38% since 1993. In addition to dumping policyholders, they don't want insurance companies for years have refused to sell coverage to people who've got pre-existing conditions, including children born with birth defects. These practices explain why 51 million of us were uninsured at the time the health care reform law, the Affordable Care Act, was enacted last year, and why that number undoubtedly would grow if it were not for that new law. Another way insurance companies are meeting Wall Street's profit expectations is by shifting more and more of the cost of medical care from them to us. An estimated 25 million of us are now underinsured because we've been shifted into plans with such limited benefits or high deductibles that we have to pay far more out of our own pockets for medical care than our family budgets will allow. Although I was becoming aware of all this during my last few years in the industry, I might still be in my old job had I not decided on the spur of the moment to check out an outdoor medical clinic that was being held close to where I grew up in the Southern Appalachians. On a trip back home to visit my folks in East Tennessee in late July of 2007, I read in the local newspaper about something called the Remote Area Medical Expedition that was being held at the Wise County, Virginia Fairgrounds, which is about 50 miles up U.S. Highway 23 from where I grew up in Kingsport, Tennessee. Well, I was curious about that expedition, so I decided to go check it out. Folks, nothing could have prepared me for what I saw when I walked through the fairground gates. I felt like I had stepped into a movie set or into a war zone. Hundreds of people, many of them soaking wet from rain, were waiting in long lines that literally stretched out of view. As I walked around, I noticed that many of those long lines led to barns and animal stalls, and the cinder block buildings with row after row of animal stalls, where doctors and nurses were treating patients. Many other people were being treated in open-sided tents. And except for curtains that were serving as makeshift doors on those animal stalls, there was virtually no privacy. All around me, dentists were pulling teeth and filling cavities. Optometrists were checking eyes for glaucoma, cataracts. Doctors and nurses were doing pap smears and mammograms. Surgeons were cutting out skin cancers. And other doctors were conducting sigmoidoscopies. As I took in the scene that day, I realized that the folks in those lines could very well have been my relatives or my parents' neighbors. I could tell from their faces that they were people with whom I shared cultural roots, but who, for whatever reason, simply had not had the good fortune to land a high-paying job in a cushy office in a Philadelphia skyscraper as I had. It was clear to me at that moment that I was having an epiphany. One of the things I was working on back at my office in Philadelphia was a document that the health insurance industry would use to try to convince people that the problem of the uninsured in this country was really not that much of a problem after all. That many, if not most, of the people who didn't have insurance were that way by choice. We were trying to make people believe that these folks simply were shirking their personal responsibility to buy coverage from private insurance companies. I allowed myself to believe that until I went to Wise County. But I learned later that 2/3 of the nearly 4,000 people who were there over that long weekend had jobs, but no insurance. Most of them worked for small businesses that could not afford to offer coverage to their employees. Many of them had tried to buy coverage on their own, but like 1/3 of all applicants in this country had been turned down because of pre-existing conditions. Others had had their policies rescinded when they got sick. Many of the people who were there were so desperate for care that they had driven from as far away as Ohio and South Carolina and Georgia and throughout Tennessee, and had camped out in the fairground parking lot overnight, some for days, just to be sure they could get in. When I said I had an epiphany that day, I meant it. I knew immediately that what I was doing for a living, which was to help make sure that insurance companies remained in charge of determining who had access to potentially life-saving care, that what I was doing was at least in part making it necessary for all those folks to stand in long lines to get care at barns and animal stalls. I left my job just a few months later. And I'm confident that I, at long last, have found my real calling, which is to explain to people, as I am now, just how broken our healthcare system really is and how vulnerable we all are to being dumped into the ranks of the uninsured. Almost all of us in this country are just a layoff or a policy rescission away from losing our coverage. And more of us are being priced out of the health insurance market because of the unrelenting pressure that insurance companies are under from Wall Street to make certain profit goals. This is why, folks, reform was so urgently needed, and why the bill that President Obama signed into law last year focused so much on forcing insurance companies to change the way they do business, and why, despite its flaws and shortcomings, it represents the best chance we've had in more than 100 years to establish a true healthcare system in this country. You don't have to take my word for it, though, or the word of President Obama, for that matter, or Democrats in Congress, or healthcare reform advocates. I'm going to wrap up our time together by sharing some facts and figures right now that you probably have heard before, some you probably haven't. According to the U.S. Census Bureau, the number of Americans without insurance increased by nearly 12 million between 1999 and 2009, from about 39 million of us to almost 51 million of us. In 1999, 14% of us were uninsured. Just 10 years later, 17% of us were uninsured. Hardest hit have been young adults and older Americans not yet eligible for Medicare. While the number of people without insurance has been going up, the number of people with employer-based coverage has been dropping steadily. The number of children in particular under age 18 with employer-based coverage has been declining, while the number of children without insurance and the number of children on Medicaid has been rising. There are two big factors for this, two big reasons. One, again, more and more small businesses, where most of us now work, can't afford to offer coverage to their employees, as I've noted before. And two, an increasing number of people can't afford their share of premiums even if their employers subsidize coverage. Their incomes have not increased nearly as fast as their premiums, and their employers are requiring them to pay ever-increasing percentages of the total cost of coverage. The average annual premiums for health insurance has skyrocketed over the past several years. Premiums for family coverage have nearly tripled, from almost $5,800 in 1999 to almost $14,000 in 2010. Before the healthcare reform law was passed, the cost of the average employer-sponsored health insurance plan for a family was projected to reach $24,000 in 2016. Stop a minute and think about that. $24,000 a year for a family health insurance policy as the average price in just 5 years from now. American families were paying 7% of their incomes on average for health insurance premiums as recently as 1987. By 2006, we Americans were paying 17% of our incomes on health insurance. Without reform to slow this rate of increase, at least half of American households would need to spend more than 45% of their incomes just to buy health insurance in 2016. If this weren't bad enough, insurers and employers are now making us pay much more for medical care out of our own pockets, even if we have coverage. It's part of a trend that Yale professor Jacob Hacker, who has been referred to as the father of the public option, calls the great risk shift. To accomplish this shift, insurance companies have been moving more and more of us into high deductible plans. This means that we have to meet increasingly high deductibles before our coverage kicks in. Total health care costs for a family of four have doubled in less than a decade, from a little more than $9,000 in 2000 to more than $19,000 in 2011, this year. This trend has contributed to the growing number of people who are underinsured. At last count, 25 million of us. This is different from the 51 million of us who don't have insurance. 25 million of us, according to the Commonwealth Fund, were underinsured as of 2007. Undoubtedly, far more of us are underinsured now. And if you're underinsured, you'll often go without care you need, just as folks do if they're uninsured. In 2007, approximately 1 in 5 Americans reported not getting or delaying medical care at some point in the past year, up from 14%, or 1 in 7 in 2003. And since 2007, it's only gotten worse. Some estimates indicate that about 1 in 3 Americans are now not getting the care they need or filling their prescriptions because of cost. The situation, folks, is much worse here in the States than in any other developed country. In other important the percent of adults who avoided care in this country is far more than any other country. And in other important measures, we're also far behind what are often referred to as third world countries, even though we spend far more on health care per capita and as a percent of GDP than any other country in the developed world. For example, the World Health Organization in 2000 ranked the U.S. 24th in life expectancy of birth. The CIA fact book says that we've actually lost ground since then. The CIA now ranks the U.S. 50th in life expectancy of birth. And we rank 54th behind Bangladesh in fairness, which is a measure of the extent to which the best care is available equally in a country. In the category of infant mortality, the Commonwealth Fund ranks the U.S. 23rd out of 23. Dead last, in other words, among developed countries. And in no other developed country are insurance companies allowed to deny coverage. And in no other developed country do people go bankrupt as a result of high medical bills. In the U.S., about 700,000 people file for bankruptcy annually because of medical debt. And folks, when that happens, it's not just one person being affected, it's an entire family usually, and generations of people. The reason I've spent so much time explaining the history and the economics of our healthcare system and sharing these inconvenient truths is because, well, no one, to my knowledge, has been doing it quite this way. And because they haven't, I don't think that few people really understand just how expensive, how inequitable, and how inefficient our system has become, our sickness industry has become, and why we couldn't wait any longer to begin to reform it. I also decided to do this because opponents of reform, led by the insurance industry and their business allies, and the politicians that they've influenced, have done a very good job of hiding these truths from us. In many cases, they've been lying to us for the sole purpose of turning us against reform. That's because the insurance industry and other special interests make a lot of money the way things are. And I know from personal experience that they will do whatever it takes to try to block any reforms that might affect their profits. Which brings me to my final set of facts and figures. Among the biggest beneficiaries of the status quo are the executives and the shareholders of U.S. insurance companies, even though they failed miserably at controlling healthcare costs and expanding coverage. The salaries of the CEOs of the big insurance companies have grown so much over the past few years that they are now among the highest paid corporate executives in this country. In fact, Forbes magazine ranks Stephen Hemsley, the CEO of United Healthcare, as the highest paid corporate executive in the United States of America. And as for the big insurers themselves, their profits have also grown exponentially over the past 10 years. In 10 years, the collective profits of just the 5 largest health insurance companies have grown from about $2 million to about $12 billion. Over 10 years, those companies have earned collectively $76 billion in earnings. That's their profits. And the most profitable years, quite frankly, have been during the recent recession, when millions of Americans have lost their jobs, lost their homes, and their health insurance. They've been able to do this, folks, because we have allowed them to take charge of our healthcare system when we were not paying attention. We've allowed them to get so big and so powerful that they get to decide who gets affordable access to care and who doesn't. We've allowed them to charge more and more every year for fewer and fewer benefits. We've allowed them to cancel people's coverage when they need it most. We've allowed them to cancel, and we've allowed them to deny benefits to millions of others just because they don't want to pay for expensive care. Well, folks, it's time that all of us start paying attention. I know that you all are, but a lot of folks haven't. So what I've just described is what happens when corporations put profits over people. It's time for all of us to do what we can to educate our family and our friends and to do our part to make sure that healthcare reform goes forward. We can improve on the reform we've got, that's for sure. But by repealing the Affordable Care Act and starting over, that, folks, is just simply not an option. Thank you very much.
Wendell, on behalf of VA Organizing, I want to thank you. There are a lot of people who look in the mirror when they've got the money to do all kinds of wonderful things for themselves, and they don't have a conscience that looks back. You looked in the mirror and saw who you really wanted to be, and we are so much grateful for you doing that.
Thank you. Thank you. Just one final thing. I don't know if we have time for questions. I'm not sure what the program is, but I just want to thank you again for allowing me to be among you. You've been working for reform a lot longer than I have, so I'm honored to be among you. Thank you very much.
We have about 10 minutes for questions. We're actually running a little ahead of ourselves. This is unheard of. So if anybody has a question, are there questions? Yes.
Sir, thank you. Thank you for that speech. I have one thing I'm curious about the Affordable Health Care Act and Obamacare. I think I saw it. Why is the insurance companies, as I understand it out of this law, got federal funding for 31 million additional policies? Why don't they love this? Why don't they love the Affordable Care Act?
They actually do. He's saying why, since health insurance companies get a lot of money, billions of dollars in subsidies to pay for people's insurance who can't afford it on their own. That money, by the way, will go directly to these insurance companies. With this kind of a windfall, why don't they like this bill? The truth is they do. They do. They like parts of it. They love that part. That's their favorite part.
31 million new policies.
That's right. That's right. That's their favorite part. They like that, and the other part that they love just as much is the individual mandate, which the judge just the other day struck down. Was it yesterday? And other judges have struck down, and your Attorney General has joined other states in challenging the constitutionality of the law, in particular that part of it. And that, by the way, was what the insurers were lobbying most for. They made many, many trips to the White House to insist that any bill that was passed included that individual mandate. And it was structured the way it is. Now, the president and Democratic leaders felt they had no alternative but to work with these big special interests. They didn't think that it was impossible at all to just scrap everything and start from scratch with a single payer system. So you have to, they felt, deal with the big institutional, these big institutions, and so that's why. What they don't like are the things that make them change the way they do business. So they don't like that part, and what they're focused on is to try to get those parts weakened as the bill is being implemented in the various states, and as the departments of Health and Human Services and other departments are writing the regulations.
Second, one last thing. I thought you greatly understated the pain that the increase in premiums has inflicted on the American people. While premiums have doubled or more on average across the American society in the last 10 or 11 years, what's happened to people's incomes at the average level? Yeah,
you're right, and that is a point that I need to make. In fact, I wish I'd had this presentation ready to go. I'm working on a slide presentation that shows some of these facts and figures in a way that I think you can really see better than by just telling them. So I'll come back. I'll do this again sometime.
All right.
The median household income in this country has not budged. In fact, it's been going down when you're looking at constant dollars. It's around $50,000 for a median household in this country. It's less now when you account for inflation than it was 10 years ago. So we've been losing ground when you consider our income, and we've been faced with these high rising premiums. That, folks, is why we can't afford coverage. We don't make as much money as we used to, but we're being told we need to pay a lot more for insurance premiums and pay a lot more out of our own pockets.
Thank you.
Yeah, I just want to comment. I agree 100% with you. Also, the administrative costs for insurance is tremendously higher than for Medicare and Medicaid. But there's another side to the story, and I don't mean it in a negative way, and that is the medical side of it, which is also controlled by AMA and hospital associations, and which is also escalating costs with overusing of testing and so on. So it's a dual kind of thing. It's the insurance companies, which are, and pardon me, ladies, screwing us, but also in some cases big pharma, and the medical establishment is also doing the same thing.
It's very true. It is not just the insurance companies, and that's why we have a sickness industry in this country. A lot of the doctors, many of the hospitals, some of the pharmaceutical companies make enormous amounts of money off of sick people. Incredible amounts of money, far more than any other country on the planet. And it is something that needs to be addressed. One of the things that Congress felt it had to do, and a lot of this bill is often criticized for not doing enough to control those costs. I think it will do some, but you have to bring more people into coverage. It's almost a two-step process. You have to bring people into coverage because one reason hospital care is as expensive as it is, among various reasons, is because of the cost shifting that has to occur because they have to see people. That is a mandate, by the way. If hospitals are mandated to provide care to folks who are sick, even if they don't have insurance, why shouldn't Americans be mandated to have coverage of some nature? I don't like the notion of having to buy coverage from a private insurance company, but you see the logic of why the bill took shape as it did.
We have two questions. The gentleman here and the gentleman in back in the stripes, and then.
Wendell, thank you for speaking truth to power as you have, and you've helped provide great, assistance to all of us as we have, continued our efforts. But the other night I had the opportunity to go to a congressional at-home meeting, and I spoke to you about this earlier, but one of the points that they were bringing up, and I'd like you to set the record straight, but one of the points that they brought up was that in order for the Affordable Health Care Act to pass, that millions, tens of millions of dollars were stolen from Medicare in order to provide for this. And I'd like you to just comment on that.
Yeah, that is a common talking point that is simply not true. There were no cuts in benefits to the Medicare program. In fact, benefits have been added. For the first time, the Medicare program will cover preventive care. And the Affordable Care Act begins to close the hated donut hole in the drug benefit. Over time, it'll be eventually closed. So people who are Medicare beneficiaries or who will be are benefiting from this in a very significant way with expanded benefits, and will have to pay less out of their own pockets for medications going forward. What they're talking about is the fact that the Medicare Advantage program, which is operated by private insurance companies, will not be making as much profit in the future as they currently are. It is not even taking money away from them now. It's not reducing payments that they're getting. It is saying that the rate of increase will be slow and that the government will stop paying the bonus that it has been paying the country. This started back during the Bush years of giving the private insurance companies more money to come into the Medicare program. It was the idea was to begin to privatize the Medicare program this way, by trying to get more and more Americans to sign up for these private plans. Well, if it was the greatest thing since sliced bread, more Americans would be in them. Only about 20% are at this point. But an enormous amount of our dollars in the Medicare program are going straight into the treasuries of these for-profit insurance companies to a large extent. Humana being one of the largest that has one of the biggest Medicare Advantage programs that I used to work for, Medicare Advantage programs. So it just simply is disingenuous to say that. It will reduce their profits going forward because it will reduce the bonuses, the overpayments that we've been paying them over the past several years.
Thank you. My question for you, I need it for translate, please. Mi pregunta para usted.
My question for you.
Es referente al dicho de que primero hay que organizar nuestra casa.
Dilo otra vez.
Primero hay que organizar nuestra casa.
Okay, yeah. My question refers to the fact that first we have to organize our house.
Y no organizar la casa ajena.
And not organize a foreign house.
Por ejemplo, la situación económica en Estados Unidos.
For example, the current situation in the U.S. economy.
Anteriormente Estados Unidos era la potencia número 1 en el mundo.
It used to be that the U.S. was the #1 superpower.
Y para ninguno es un secreto que hoy estamos en el 9º lugar a nivel mundial.
And for us, it's no secret that it's gone down somewhere like in the 9th place around the world.
Quería hacerle la pregunta de que para usted es necesario o sería bueno que regresen las tropas y no estar gastando ese dinero en las tropas y ayudar en la economía en este país a las personas.
I wanted to ask you if you don't think it'll be nice to also fight for that the troops come, for example, the troops come back so that we save all that money and that we can work on rebuilding the economy here.
Well, I think it would be, yeah, if we can get out of the wars that we're in, if we can bring the troops back home, absolutely, we'll be spending far less money than we are now. So that will be a big way of saving dollars that I think many of us think we shouldn't have been spending in the first place. Secondly, you're right. There's a lot we need to do to transform our economy and to reduce spending. That's one reason why reform is necessary. Is again, if you're spending 17% of your GDP on healthcare, that means you can't. It keeps going up. It means you know there's a finite percentage. There's only 100%. If you that means that you have to spend less for something else, and our infrastructure needs fixing. There's a lot that needs to be done. So if we can get healthcare costs under control and bring the troops back home, you're right. We can. Those things in and of themselves will help to bring the deficit down and help with our debt.
Okay, this is the last question.
This question has to do with ethics. I worked in hospitals as a technician for several years. The #1 credo of the doctors is do no harm. And you said that doctors were protecting their large incomes. How can they justify that? It's kind of a sustainable mission, if they're making a bunch of money, and they can't give care to other people, and does that impact the corporate thinking at all?
Well, it does, and you do that by with some separation. That's why groups like the American Medical Association does that rather than individual doctors. Individual doctors probably don't spend a lot of time. They do, but they look to their trade associations to try to be the organization that has power and clout and money to do that. So the individual doctors can feel some, I guess, absolution for being involved in that effort. But they absolutely are complicit in it because we specialists in particular, like as you know, a lot of money in this country, more than anywhere else in the world. Far, far, far more than primary care doctors. And as a consequence of that, because of the way the incomes have developed in this country, we have a shortage of primary care doctors. And the Affordable Care Act does try to reverse the trend away from more and more medical students going into specialties. Now it's a small fraction of medical students go into or plan to be primary care doctors. So that's something that's got to change.
Wendell, I promise this really is the very last question. And we need one of the interpreters, I think, for the gentleman that's standing up.
Yo solo quisiera decirles que
I just want to tell you that
de lo que he estado escuchando sobre los problemas sociales que vivimos en este país,
what I've been hearing about the social problems that we face in this country,
para mí la salud en este país es más cara que en América Latina.
for me, healthcare in this country is more expensive than in Latin America.
Y les digo esto porque yo lo vuelvo a repetir. Yo trabajé en una empresa donde realmente en mi país se daban buenas prestaciones a los trabajadores.
And I'm saying this because I worked in a company back in my country, in Salvador, where there was good benefits being provided to the workers in this company.
Y pagábamos poco por
We
la
paid
salud.
little for these benefits.
Y aquí nosotros vemos las grandes corporaciones. Voy a poner un ejemplo.
And we see here we see this huge corporation.
Tenemos la corporación de Cargill,
Like for example, Cargill,
que trabaja con carne.
working with meat.
Nada más el año pasado los aumentó $12 en la aseguranza a los trabajadores.
Last year they raised the amount of money they take away from the worker's paycheck for $12.
Yo trabajo para esta compañía
I work for this company.
y le pone 3 precios como en los países de nosotros le ponen el precio al frijol y al arroz.
And they give different prices, just like in our countries, we give a certain price for beans and a certain price for rice.
El arroz que está más aseado vale más y el que menos aseado menos y el otro vale más barato todavía.
And clean rice is worth more and dirty rice is worth less.
Así juegan con la salud de nosotros en este país.
This is how they qualify our health in this country.
Así es que sobre eso tenemos una gran lucha como líderes nosotros en la organización.
For this reason, we have this huge responsibility as leaders of organizations.
Para que esa reforma realmente sea una realidad y ya no estemos creyendo en cositas que no nos van a funcionar en este país.
So this reform may be a reality, and we're not believing in little things that are just not going to work in this country.
Es una lucha grande y difícil, pero se puede lograr. Claro que se puede, siempre y cuando nos unamos nosotros y podamos ayudar a nuestra gente a que se una con nosotros.
And it's a big fight. It is a big fight, but we can do it as well as we can.
Healthcare is more expensive not only here than in Latin America, but any other place on the planet. And these big companies like Cargill are indeed making a lot of money, and they're shifting more of the cost to us because they too are under pressure from Wall Street to make a certain percentage of profit. And to be able to do that, they have to shift more of the cost of the premiums and the care to us. So we've got a lot of reforming yet to do, folks. Thank you very much.